For those of you who have not attended our phlebotomy conference here in Rochester, the title of my hot topic today, Phlebotomy Top Gun, may seem a little odd, but I hope I'll be able to explain to you what Phlebotomy Top Gun is and what we try to do at our annual phlebotomy conference. Every year at Phlebotomy Conference, I present a talk called Phlebotomy Top Gun. The format for Phlebotomy Top Gun is a case-based presentation. I solicit from conference attendees ideas for these cases based upon issues or questions you have related to phlebotomy. I present these as case-based scenarios, and using an audience response voting mechanism, the attendees of the conference vote on the action or answer they feel is appropriate for each case. I then present the evidence and data from the literature and Mayo Collective experience related to the topic. At the end of the case, the attendees vote again. For each case, I can see whether I've been able to change anyone's mind on the question at issue by presenting the data and information relevant to the topic. This is an actual case from a previous year's phlebotomy conference Phlebotomy Top Gun presentation, derived from a question about the validity of measuring potassium from capillary puncture blood samples. I have no disclosures related to today's talk. Based upon the question submitted by a phlebotomy conference attendee 2 years ago, I presented this question to the conference audience. Regarding capillary compared to venous potassium measurement, which of the following are true statements? 1. Capillary samples are on average more hemolyzed than venous samples. Therefore, potassium is systematically higher in capillary samples. 2. For a given amount of free hemoglobin or hemolysis, the increase in potassium is higher in a capillary sample compared to a venous sample. 3. Experienced techs or phlebotomists can collect capillary samples with no more free hemoglobin or hemolysis than a venous sample. 4. Both 1 and 2, the first and second responses, are true. Or 5. All of the above responses are true. At the phlebotomy conference, we would use a live audience feedback system to poll the audience and see what audience members believe to be correct about this issue. For those of you watching now, which do you think is the correct answer? What I do next with each case in the Phlebotomy Top Gun presentation is go through the data and evidence, internal or external to the Mayo Clinic practice, that I can find related to this question. At the end of the case, I re-poll the audience to see if anybody's mind has been changed. To remind our audience today, capillary blood is really a mixture of arterial blood, venous blood, and interstitial fluid, the fluid that bathes the cells within our tissues, and fluid released from cells during the capillary puncture itself. The combination of interstitial fluid and cellular fluid is often called tissue fluid. While concentrations of most chemical analytes are identical or very similar between arterial and venous blood, it is the tissue fluid that can vary dramatically in the concentration of various analytes we measure in the laboratory. To make matters more complicated, each capillary puncture will have a different amount of tissue fluid collected into the sample. The importance of this variable amount of tissue fluid collected in capillary sampling differs by analyte and depends upon how different the cellular and interstitial concentrations of the measured analyte are compared to venous or arterial blood. For example, there is no hemoglobin in interstitial fluid, so variable amounts of interstitial fluid will cause variability in capillary hemoglobin measurement compared to venous or plasma hemoglobin. After meals, interstitial fluid glucose concentration changes more slowly than venous or arterial glucose, and this complicates interpretation of capillary glucose in the non-fasting state. So what about capillary sampling for potassium measurement? Let's explore this question further, remembering that we break more cells during capillary puncture than during venipuncture. On this slide, I provide a reference to an older study comparing potassium values from infants with simultaneous blood collection from an indwelling arterial catheter compared to a capillary heel stick puncture. The capillary samples yielded potassium measurements that were on average 1.2 millimolar higher than the paired arterial serum sample. consistent with the results of several other studies that demonstrated that capillary potassium measurements do run higher than values obtained from either venous or arterial samples. But the question is, why is this? This next study, also a bit older, compared the average amount of free hemoglobin from hemolysis during capillary blood collection between infants and children of varying ages. For comparison, the average amount of free hemoglobin in a venous specimen collected from an adult is less than 50 milligrams per deciliter. As you can see, capillary punctures performed on infants in the first 2 weeks of life resulted in, on average, almost 400 milligrams per deciliter of free hemoglobin in these samples. By 2 years of life, the average free hemoglobin level decreases to around 150 milligrams per deciliter. So capillary puncture in very young infants will have more free hemoglobin than capillary puncture in children older than 2 years of age. This next study was performed at Mayo Clinic around 10 years ago. We wanted to know whether phlebotomist training impacted the amount of hemolysis or free hemoglobin in capillary puncture samples from newborns. We looked at 3 groups of capillary puncture samples. Group 1 consisted of capillary punctures performed by an outpatient phlebotomy group, while Group 2 were samples collected by the very same group of outpatient phlebotomists after specific training or retraining, in this case, on capillary puncture in infants. Group 3 consisted of samples collected by an inpatient pediatric phlebotomy group that has more experience and does more newborn capillary collections. As you can see, the bottom line of our study was that experience in terms of number of capillary punctures or retraining of staff had no effect on the hemolysis levels or amount of free hemoglobin in capillary puncture samples from healthy newborns. The last formal study I'll discuss is perhaps the most interesting. This study compared the amount of free hemoglobin, this time measured as a semi-quantitative index, to average potassium concentration in both capillary and venous samples. The study compared average potassium levels in thousands of capillary and venous samples. The average potassium in capillary and venous samples that had no hemolysis was the same, as we would expect, at 4.0 millimolar. A small amount of free hemoglobin in venous samples, the semi-quantitative H indices of 1 or 2, resulted in a modest increase in potassium to 4.2 and 4.5 millimolar respectively. In contrast, the same amount of free hemoglobin increased potassium in capillary samples to 4.5 and 5.0 millimolar. In other words, the same amount of hemolysis increased potassium concentration more in capillary samples compared to venous samples. This last slide describes our internal validation study of capillary blood gas testing at Mayo. We collected capillary blood gas specimens from 22 healthy infants after heel warming and with hand transport of the capillary blood gas specimens to the testing lab. The average potassium level in the samples was 5.7 millimolar, so our study was consistent with others showing, on average, higher potassium levels in capillary compared to venous samples, which would have an average around 4.0. A look at the individual values for the 22 infants demonstrated potassium levels in these normal healthy infants of anywhere between 4 and 10 millimolar. Based upon this data showing wide variability in potassium in healthy infants, we decided not to report potassium values in capillary blood gas samples from newborns. To summarize the data and studies, capillary samples contain more free hemoglobin, higher levels of hemolysis, than do venous or arterial blood samples. One study did find that for a given amount of free hemolysis or free hemoglobin, potassium increases more in capillary samples compared to venous samples. I believe that potassium measurement in capillary blood samples should only be done in laboratories that have the ability to measure free hemoglobin with every measurement and have a good process to withhold results when there is too much free hemoglobin to produce reliable potassium results. Testing laboratories might also consider implementing a stricter or different threshold for the amount of hemolysis or free hemoglobin in capillary samples. At this point during the Top Gun phlebotomy presentation at our phlebotomy conference, I would repoll the audience to see if any attendees had changed their minds based upon the information I just provided. I would also reveal what I think is the correct answer. In this case, I believe the correct answer is answer 4. The first two statements are true. Capillary samples have more free hemoglobin than venous samples, and there is some evidence that a given amount of hemolysis in a capillary sample increases potassium more than the same amount of hemolysis in a venous sample. However, there is no evidence that phlebotomist training or experience can impact hemolysis levels in capillary punctures. I've provided for you the references to the studies I mentioned here today.
Thank you for your time and attention. If you liked today's presentation, or even if you didn't, please do consider attending the upcoming Mayo Clinic Laboratories Phlebotomy Conference, Phlebotomy 2021, Empathy, Engagement, and Excellence in Patient Care, which will take place as a virtual conference this year on April 15th and 16th, 2021. As in previous years, the conference will feature presentations from expert speakers covering a variety of topics related to phlebotomy skills, phlebotomy management, and other topics. Learning will take place via virtual large groups and virtual small breakout group sessions. Virtual tours of the Mayo Clinic facilities will also be offered during the conference. I will also be presenting an all-new phlebotomy Top Gun presentation based on this year's attendees' interest, issues, and concerns as expressed during the registration process. More information on the Phlebotomy Conference program can be found on the Mayo Clinic Laboratories website. Thank you for listening and have a wonderful day.